Good morning, good afternoon, or good evening, depending on when you're watching the replay. We are going to record this session today. We're coming at you guys live, and Dr. Barry Feldman will be joining us here in a few minutes. But we are going to put the replay up for your guys' availability on Get Motivated University so that you guys can access it anytime that you want.
Yeah, I'm excited about this, and this is something that we sort of had the intention of doing for a while.
Mhm.
And I guess with the recent suicides that we've had in veterinary medicine, it's absolutely time. We've taken some actions, but it's a small refinements upon something that's already good that makes it great. That's what one of
Mhm.
my mentors, Earl Nightingale, has said, and so we're making some small refinements over here at Get Motivated to hopefully do more to make a more positive impact on the veterinary community and to really just help and support veterinary professionals, right?
That's right. That's right. And we as a team, we conversate throughout the week, and we wanted to open up those conversations to everyone, to the profession, because we understand that not everyone has access to the experts, and there's a real sense of community that can be fostered when we come together with these conversations. And I think having the conversations continuously, you know, whether there's an event that sparks the conversation or whether we're in a period of time where, things are, uneventful. So I think that that's really important too, to continue the conversation.
Right? Because I mean, where do people go to have a suicide conversation, right?
Right.
I mean, you call your mom, or you call your brother, your sister, or your friend, or a colleague, or someone else. But I know me personally, I never had any formal training in
Mhm.
suicide, just prevention, what the myths were, what the misconceptions were, or just any formal anything about suicide up until meeting Dr. Feldman and doing that course recording with him. And I believe
Okay.
even as a well-being individual, I was still using terminology like committed suicide, right?
Right.
And things like that.
And what he's speaking about is, there are terms that are more appropriate to be using when we're discussing suicide awareness or a death by suicide.
Right.
And you're right. I took the QPR, I think, a couple years ago, but that again was after I met Dr. Feldman.
Right.
And
That's more importantly, that's 14
mhm,
years into your veterinary career, right?
well, longer than that.
Right. Well, it was
Longer
a
than
couple
that.
couple of years. You've been in for
But
how long?
yeah,
16 something years. So it's like
long time. Yeah.
it's
Yeah.
way deep into your veterinary career is when
Hmm.
you're first getting the knowledge about
Right.
uh, the stuff, right?
Right.
And it's the
Absolutely.
same way for me, and I imagine it's the same for a lot of individuals. And I'm not sure why that is.
Yeah. And so to kind of, depending on when people are watching this, last week, was it? Or maybe it was the week before,
Well, let's just say over the past 2 weeks.
over the past 2 weeks, right? Okay. We've had 4 deaths in our profession by suicide. And that's not, I, it's not unusual that we have death by suicide, right? Quincy, what's the statistic? We are, as far as a profession goes, are we the 4th profession in the world with the highest?
I know that's
Um,
been a statistic over the
that's been,
past
mhm.
12 to 24 months for sure. If that's
Okay,
changed,
yeah,
recently, I don't know if we're in the lead now or
right,
however you would look at it like
hmm,
that. But because I imagine those numbers could change, right? It's still
sure,
a thing, but I know that the veterinary medicine and veterinary professionals are 2 to 4 times greater at having a chance of dying by suicide, right? Or our
right,
suicide rate is 2 to 4 times that of the general public.
higher of it, hmm,
And
yeah,
so, and I believe that 1 in 6 veterinary professionals is having suicidal ideation, right?
hmm,
So, actually having thoughts about killing themselves,
yeah,
and that is something that is really profound if you think about it. Right? You go to a conference, you see, you know,
Hundreds of people.
hundreds of people, and 1 out of 6 of those maybe have thought about.
Right. Well, or even just in your clinic.
Yeah,
So
maybe
just in our
talk about
clinic, but the average clinic has about 20 employees in it. And so you could imagine that at some point in time, 1 to 2 of those employees, if not more, maybe 3 if you've got 21, right, is having these types of thoughts, or is having some sort of struggle around their mental health or well-being. And so, again, like what we were talking about, is getting access to the resources, raising the awareness. And when Dr. Feldman joins us, we're going to walk with him sort of backwards through a response of what it would look like to respond appropriately, post a death, and then moving toward intervention and then prevention, and what we can do as organizations as well as individuals to make a difference in our own lives, in the lives of other veterinary professionals, and then as an industry, as a community as a whole. And we don't and this is not even just a national problem, this is global. And so we want to be able to really make a big impact globally.
Yeah, yeah, I agree 100%. Um, and neither Renee or I are like licensed mental health professionals, just to throw that out there.
Yeah,
Dr.
that's good.
Feldman is,
Hmm.
but I just consider myself like a well-being enthusiast,
Hmm.
or when I'm kidding around, I say I like to geek out on well-being, right? I'm a well-being nerd, a well-being geek.
Yeah.
And the reason I am is because I believe it's like the vaccine for to me, it's the vaccine just for suicide
For
prevention, because
you.
I know I
Yeah.
can stay ahead of any suicidal thoughts or any
Hmm.
depressive episodes, or I have these things called burnout episodes,
Hmm.
but I don't feel like I can become truly burnt out because of the well-being tools and strategies and resources and tactics and strategies that I've got for myself. And so I can say from personal experience, I'm not sure if it'll work out for you the same. I believe it
Right.
would, but almost like that vaccine against poor well-being, that vaccine against burnout is really prioritizing and focusing on your well-being long before you even get close to burnout, right? Like we don't want to
Right.
wait until the puppy is, at the dog park to be like, oh, maybe we should get that vaccine. Like it's a little bit too
Yeah.
late at that point. You don't wait until the
It's a
puppy
different
starts
approach
having
then. Hmm.
watery diarrhea, bloody diarrhea, inappetent, lethargic, and vomiting, right? It's a
Hmm.
little late for
Hmm.
the vaccine at that point, and so now you've got to go to ICU, right?
Yeah.
So
And then you
I like
kind
to
of work
focus.
backwards from there, right? You would do the
Right.
same thing. You would work back from there. You would treat the problem. And so you brought up a really great point, is that that preface, this disclaimer is not to replace any sort of recommendations that you would get from your personal mental health professional or physicians that you'd be working with. Again, this is a conversation. This is intended for informational use or even entertainment use. Okay, so we want to make that clear. Same for me, doc, is that my well-being, I've been on the journey for over 10 years personally, because I struggled greatly in my early 20s within about 5 years of being in the profession. And I was able to sustain in the profession because of the shifts that I made in my own mental health and well-being and in my lifestyle. And so for those people who have, there's a spectrum, right? There's a spectrum. There's things within our control. There's things without or that are without our control. People with different, genetic makeups, chemical makeups, things of that nature. And so that's really key, is that when you're looking at well-being, it's necessary that you personalize it. Personalize it. That's what's really important, because that's what's going to make the difference for your life. And so just take that. And it looks like Dr. Feldman's ready to join in. Is that right?
Yep, yep. So we've got Dr.
Great.
Feldman joining in.
Good morning, Dr. Feldman. How are you this morning?
I'm fine. How are you?
Doing well. We were just talking about well-being, and we discussed a little about what's been going on the past couple of weeks, and how Dr. Holly and I and you and the Get Motivated team are looking to open up this conversation and not replace any sort of specific or personal mental health recommendations, but to be informative and just open up this conversation to the profession. So thanks for being here with us this morning.
You're welcome. Happy to be here.
We could. So Dr. Feldman, So Dr. Feldman was the keynote speaker at one of the well-being summits. I think it was in 2018, and he did this breakout session. And this is something that I think people in the industry will be able to understand. But there's different rings of connectedness when someone dies by suicide. Can you shed some light on that, Dr. Feldman? Walk us through what that looks like and, how the different people can react or, have that.
Sure. Happy to do that. And I just want to preface my remarks by saying I'm not trying to make mental health professionals out of anybody, watching this broadcast. But I do want to provide some, I think what might be some helpful information. So, as I'm sure many of you realize, suicide can be a very complicated situation. And, it's very important, dealing with the aftermath of a suicide death, requires like planning and putting protocols in place and strategies to help assist those that are unfortunately left behind by the loss. And so one of the things that's been helpful in my work is, in terms of providing support to those affected, if you can conceptualize like an archery target. And I use that analogy because many people are, most people are familiar with what the target looks like, specifically that in the middle there's a bullseye, and then there are other rings that emanate from the center of that target. So, in terms of identifying and planning a response to what we call a postvention type response, dealing with the aftermath of suicide, utilizing that archery target as kind of the focus. So the bullseye, obviously those would represent those people closest to and most affected by the death. And so as you emanate from the bullseye, towards the, farther out, I think you get the analogy, center target, those more closely impacted. And as we move further out, people will be impacted in different ways.
And is there a different response for the people that are in those different rings? You have a postvention program, but, is there a different response that people would take, an appropriate course of action, or, if maybe someone across the country doesn't know the person directly, but they're feeling, something emotionally based on the information, does that make sense? Like they would maybe take a different course of action than the people who directly work with the person, right?
Well, it's not so much taking a course of action, it's planning, the response kind of in an organized, in an organized manner.
Okay.
And kind of paying attention. And, I don't think we could necessarily, draw up a blueprint for a, response protocol here. But let it suffice to say that concentrating efforts on those most affected, and concentrating efforts can include, targeted intervention, potentially talking with those people, seeing and identifying who might be more affected than others.
Okay.
And, the response can vary depending on the needs of those involved. So,
Yeah.
to your point, someone across the country, were they a colleague, were they a close friend, or were they, a member of the profession, which obviously is impacted by the death. So that's kind of the rubric that I typically use to help people plan their post-vention responses.
Would you want to discuss what sort of elements would be necessary in a post-vention response, or just something, would that help people to understand that there are different elements, or is that too detailed for a general discussion?
Yeah, it's hard for me to, I think, generalize in that respect. But I think it really, what the goal here essentially is to try to, provide what I call like a competent, caring community, in the workplace, in particular, where coworkers, colleagues, friends, even, from work can be impacted, in a stronger manner. So the response would depend on what are the available resources. For example, are there employee assistance programs available to help, where there are mental health professionals who could, be of assistance. Also realizing that, yes, many people will be impacted, but the overall concern is to, again, pay attention to those who might be most impacted. And what can also be related to being impacted is the previous mental health history of others, previous trauma history. So those are elements, that could potentially impact the equation. But the key is to do something, and do it in a planned, thoughtful manner.
Dr. Feldman, I'm not sure if this is the appropriate space to talk about it or appropriate time, but I remember we discussed suicide contagion at one point. Is that something that we should talk about to really, because I'm not sure that everyone takes it as seriously as we should. In terms of leadership for hospitals, uh, I'm almost positive that there are going to be some leaders in hospitals who kind of look at this thing and like, what just kind of happens, right? And maybe they could have someone on their team who is displaying warning signs, but they're going to miss those because maybe they just aren't taking it seriously. And so, with the multiple suicides that we've had over the past couple of weeks, like, does that increase the risk? I guess now everyone's got a sort of a risk factor, at least at this point, right?
Yeah, yeah. Well, the research shows that for specifically certain age groups, in particular adolescents, and adolescents, typically up to age 24 or 25 in terms of, years of life. Adolescence is obviously a stage of development, but it does extend all the way up to ages 24 or 25 as related to brain development. So, there is this phenomenon that's been identified multiple times through the research, that exposure to a suicide, exposure to a death by suicide, can potentially cause individuals who may be struggling on their own to perhaps develop kind of a skewed a vision or a skewed perspective of suicide. In that, so we try to focus on providing assistance, as I said earlier, to those who might be most impacted by the death. And one of the reasons why is to potentially identify those that might be most vulnerable to having distressing outcomes, more depression, more anxiety, but up to and including potentially engaging in suicidal behavior themselves. So yes, the contagion aspect is important, and that's one of the reasons why in schools and hospitals and workplace settings. It's important to establish suicide prevention programs that include what we're talking about, which is the post-vention response.
And so for individuals who maybe, who don't hold a leadership role in the profession or in their organization, what can an individual do, right? If we think about the typical response that we've maybe seen so far to hearing about the news, getting access to support, right? Like that's something that an individual could do because that's within their control. But then also, they could, they could take it a step further, right? And advocate that it be brought into their organization to provide support for other people too.
Yes, I think, I think a good example of this is when we read about, in the newspapers, or people are familiar with, for example, a suicide that occurs at a school or a college. You'll read, you'll typically see in the media that grief counselors have been brought into the school. Grief counselors will be available for students and staff to speak with. So, providing that kind of resource is really important, and it indicates very clearly the need to focus in on those impacted by the death. So yes, having resources, as I just mentioned, human resources, having websites, literature available. It's all about trying to, as I said, create that competent community in the workplace, caring for each other. So those are just a few of the things that can be done to potentially provide assistance.
And what about if, as an individual, how can you tell if you're maybe more affected than what you think you are? If maybe we have this blind spot, like let's say I'm an average bear, I don't have a relationship with a mental health professional, and I think I'm fine, right? Are there any sort of maybe,
Well, there are common, there are commonly identified signs and symptoms that people can experience, reactions that people can experience from a sudden traumatic loss.
Okay. So maybe, yeah.
And those signs and symptoms can vary, depending on, the individual. Common reactions can include, like depression type symptoms. And look, let's face it, when something tragic and unexpected occurs, like, a suicide occurs, someone that, or that you work with, then it's a shock. So, people will have acute reactions. The key is to pay attention, to oneself, and, that over time, those reactions will dissipate. They will lessen, typically. But, I said common signs and symptoms of reactions. That's the point. That people, they're normal human beings. They're having normal reactions to an abnormal event, which suicide really, typically would be considered. So there's, again, no single overlay, but the importance of paying attention to those common signs and symptoms, which can include, poor concentration, trouble sleeping, or too much sleep, too little sleep, appetite disturbance, eating too much or too little, anger outbursts. Again, those are just a few of the examples that can, be noticed.
And that's okay.
And sort of one thing that I have kind of personally experienced is having wounds reopen if you you know, I experienced the 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 loss of two neighbors to suicide over the in the past year. And so for me personally, when we have instances of like what occurred over the past couple of weeks, like it brings that back. And so I found myself thinking about my neighbors, my friends
Sure.
more often, you know,
Mhm.
and that I think can probably affect your concentration, right? It can just the affect just the overall quality of your day, and it makes you, for me personally at least, it had me thinking like, wow, there are other people across the country now who are having very similar, probably feelings of pain. The individuals who knew, the ones that we lost, and so it really brings up a sense of compassion of like, wow, I know people are hurting in other places, and you know, I was fortunate, Dr. Feldman, in that I had you to talk to, right? And I just imagine like who I mean who could I really call, because those conversations were really important, and I'm just hopeful that the the people around that center point of the archery target had someone to at least reach out to and speak with about what are normal
Sure.
feelings of pain, and so they can have an idea of, you know, what to do
Sure.
next, what to watch out for.
Yeah, I think, as you said, people that they can reach out to. And I'm also emphasizing the importance of, appropriately reaching out to those individuals who are impacted. So, it's a kind of a bi-directional situation. Resources available that the individual might be affected can potentially utilize, but also resources that can be brought to bear on the situation from maybe the outside if necessary.
And in your to your point, Dr. Holly, is that when it stirred up some emotions, um, there's sort of two ways that you can go with that, right? Is either A, to deny it or resist it, or to, not allow yourself to feel it. Like, because I know I've talked to people before who have said to me, I feel like my problems, like other people have bigger problems, and I don't want to take the resource from someone else. But I think that giving yourself permission to feel it, giving yourself permission to, process through it, right? Because did you do anything different that day when you felt that way, Quincy? Like, what did you do that day when that sort of stirred up for you?
I
You
just
know,
sat and cried. Yeah,
but you felt it,
yeah,
right?
yeah.
You like,
I just
Sure.
processed
You
through it.
recognize that you were affected.
Right.
And, I think that's a key point. The insight, person have the insight to know that, hey, things aren't right. I'm affected by this. It's kind of rocked my world. Again, the degree of that can vary as we've been
yeah,
discussing.
Right.
Um, but there's no shame. There's no, it's not weakness.
yeah,
Uh, People hopefully don't feel embarrassed. I know there can be, unfortunately, a stigma against accessing mental health services. Um, but hopefully the people, watching this and listening to this broadcast, understand that and are not too hung up by that.
mm-hmm.
We're human beings. We have emotions, we have feelings, we have reactions to situations. And yes, pretending that they don't exist can be very, very detrimental. No doubt about that.
Yeah,
Right, right. And then Renee, just to kind of going back to having a well-being toolbox, and having self-awareness through
mm,
introspection of what things you need to do to process through emotions, and maybe if you're starting to have wounds reopened, and knowing that there's professional help out there if you feel
yeah,
that you need that. So just knowing the full range of things that you can do to to really support yourself, And I've got my favorite books, my favorite audiobooks, my favorite videos. I've got my wife to talk to. I've got you. I've got Dr. Feldman. I always feel like I have like the world's greatest well-being army. So you know, if I
Yeah.
really need something, I know where to go.
Yeah.
Yeah.
So let's switch gears a little bit and maybe move, backwards in the process about educating ourselves so that we can, so that we can help our neighbors, right? So we talked a little about that self-care and helping ourselves as individuals, which I think is really, really important. Oxygen mask theory, like we've got to be able to help ourselves before we can serve others. But educating ourselves so that we can help the neighbors. We've got a program, you guys, right? Different than QPR, but I think that that's something that we can talk about because as leaders or as individuals, just colleagues, when we're looking like at intervention, right, moving kind of up that road is into intervention or even prevention. What do you guys think are some of the most important, what are the easy ways to educate ourselves, most important factors when it comes to educating ourselves so that we can get ahead of these things, like you had mentioned, to whether it's for ourselves or for our neighbors?
I think that, suicide prevention in general starts with education and awareness. In my travels throughout my career, there's just an overall unfortunate general lack of understanding about suicide itself. So when people don't understand something, or they don't, they're not knowledgeable about something, there could be a tendency to, dismiss it, to ignore it, or conversely, to be afraid, to not want to even bring up the topic. As we've, talked about in the course that we have, Get Motivated University, debunking the myth that, that we shouldn't talk about suicide because we might give somebody the idea. Well, talking about it is, raises awareness and increases knowledge. Debunking the myths, the one I mentioned, and other myths that people have, and about suicide, because they don't understand it. And many people will also feel that, well, that's a person's business, what they want to do with their own life, that's up to them. Well, as we've been talking about, today, the ripple effect of suicide is profound. So starts with raising awareness and providing education. So we know that among the veterinarian community, suicide rates are higher than they are for other professions, and in many instances higher than the rates of, in the general public. So that in and of itself should cause people to, to pay attention. What's going on here? And ask the question, why? What can we do to try to help? What can we do to try to, reverse that trend? So prevention, as I said, education and awareness is paramount.
And awareness is different than prevention and education, right? So we can kind of see some awareness through people, changing their profile pictures. There's a frame, that they can change to kind of raise awareness. They might shed light on like a walk or something like that, or resources that are available. And then, so that's in my mind, what awareness is just kind of talking about it, and then, bringing it up to people who are outside of the industry, who might be oblivious to the fact. And then prevention falls under your education part, right? Is me educating myself, educating people that I know, and deeper into, like you said, understanding it to where I feel comfortable talking about it. When we were at a meeting, we were at a conference, one of the veterinarians said, how do I even have this conversation? How do I start this conversation? Right? It seems simple enough, but there's a huge roadblock to that, because like you said, they're not educated. They might feel like they might make it worse, or they don't know what words to say.
Mm-hmm. Well, I think that just sort of to reverse what you said a little bit, I think under the prevention umbrella, would be education, raising awareness, and increasing people's knowledge. Increasing people's knowledge can hopefully lead to skill building. And skill building can be the ability to ask somebody that you're concerned about, if they're doing okay. That's one of the major national campaigns of national suicide prevention organizations. I think T-shirts are you okay? Because let's face it, we walk, we go by people all the time in the hallways, in the workplaces, on the sidewalks, when things were a little less impacted by COVID, of course. But, we don't know what's going on oftentimes in people's minds. So sometimes, the importance of being able to ask if somebody's okay. So that initial trepidation of, you alluded to, what do I do? What do I say? Well, providing some tips for doing that is part of, this whole prevention effort. No doubt about it.
Is there anything else that you think would be, important to talk about here today? Or do you think there's anything that when this comes up for us, there's really big key points that are missed in these conversations, or,
Well, there's a lot, but not, I can't get everything included in our segment today.
Yeah.
The opportunity to talk about suicide and mental health, stress and distress, very, very, very important in the veterinary profession to talk about. I think, as I said earlier, it's not about weakness. If people are struggling in the workplace or in their relationships, it happens. But I use a simple analogy that I think people can relate to. Again, you think about like an automobile. If you have a noise, your engine's making a noise, and there could be a tendency to think, oh, okay, well, that's nothing. I'll just see if it goes away. So maybe that noise will go away for a little bit of time, but then it can reoccur. And if you don't pay attention, the problem can get worse. So, knowing ourselves, paying attention to ourselves, those around us who may, who know us well and maybe see some things that might be concerning to them, pay attention to that kind of feedback. Really, really important. And I just want to conclude, I think, by saying that, it's suicide, unfortunately, is a problem in the profession. It's a problem in our society. And, we want to do our part to try to help people, A, understand, B, gain more knowledge, get educated, and C, to feel more confident and competent in just talking about this issue.
Yeah. So for people who want more, who want to be able to access the prevention, the education, the skill sets, what are some of your favorite resources? I know of some, but do you have some favorite resources that you point people toward that, whether it's just, we'll say in the United States?
Yeah, I mean, there's a lot of good national organizations devoted to suicide prevention. The American Association for Suicidology is one. the Action Alliance, National Action Alliance for Suicide Prevention, American Foundation for Suicide Prevention,
Okay.
are some of the top national organizations, but also the NIMH, National Institute of Mental Health. Mm-hmm. There can be some statistics, some data, suggestions, information about warning signs and risk factors, all related, again, towards suicide prevention.
Yeah. And I'm going to put some of those in the, we're going to have this replay available on Get Motivated University, and I'm going to put some of those links available. I know the AVMA partnered with a number of different organizations, and Jen Brandt, they put out like a guide. The VIN Foundation has a number of resources that are available to people, peer-to-peer mentorship and mental health resources. Get Motivated University has your courses on there. You're launching another course on the stress and distress. And what I found interesting too is people can get involved in those national organizations, right? Like they could get involved. So if they wanted to, we'll say, next level their awareness or their involvement in actually doing something and, getting away from the moving and talking about it, taking action. So you can actually partner with these organizations and, bring it live to your community in some sort of way.
Yeah, absolutely. Many, many opportunities to become involved in suicide prevention efforts. Yes. And, we know that every September, National Suicide Prevention Awareness Day, World Suicide Prevention Day, et cetera, occur in September, the purpose being to highlight, the awareness. But as I've said many, many times, we need that
more than once a year,
year round. So there's plenty of opportunity for people who want to get involved. Absolutely.
Yeah, that's good. Well, I think we'll conclude it there. We'll conclude it there. And if you guys have questions for us, if you guys want us to address anything from the next portion of conversation, just let us know. Again, our contact information will be available to you guys, and you can just connect with us. I know on Instagram, we actually had someone reach out and say, I work tomorrow, I can't be present, where's the recording going to be? And so I wanted people to know too, if you can't be present and you had a specific question, let us know, and, we'll address it and send you the recording. So hopefully these types of conversations continue. I know we're going to make our best effort to have that happen and let it be available freely to all of the professionals, because like you said, mentioned in the beginning, this is that what happened in the past couple of weeks are 4 deaths that we know about. And some were veterinarians, others were veterinary assistants or technicians, but, we recognize everyone in the profession, no matter what your role is, as being a veterinary professional.